the 5-star rating system and updates. The first update we'll begin with is the staffing rating changes. The staffing rating was frozen earlier when the pandemic first began, and in July, CMS updated providers to inform them that the freeze would be lifted and reporting would begin in October of 2020. With the October 2020 refresh of the Nursing Home Compare, using data that was submitted on August 14th, that was the deadline to submit your data for the second quarter of the year for your staffing. So the data that you are currently seeing reported on the Nursing Home Compare website for the month of October, November, and December is using data that was reported from quarter 2 of 2020. Facilities that did not report staffing for the August 14th deadline or that reported 4 or more days in the quarter with no registered nurse will have their staffing rating suppressed, and it will show not available or an A. You all may have seen that if you looked at your 5-star rating report that came out in October, and the last one was just released in November 16th. Staffing data for quarter 3 is required to be reported on November 14th, 2020, and today, of course, is November 21st, so that deadline has passed. But the Nursing Home Compare website will refresh the staffing ratings January 1st, 2021, and it will report the data for July to September of 2020. Facilities that do not report staffing data for the third quarter of 2020 or facilities that report 4 or more days in the quarter with no registered nurse will have their staffing ratings reduced to 1 star. So remember, if you had a 2-star or 3-star in your staffing rating in October, November, and December, and on January 1st, 2021, the Nursing Home Compare website will refresh its data and use data that was reported by November 14th for staffing reported for July 1st to September 30th of 2020. Just so everyone is aware, before the staffing data would use the case mix adjustment from RUG 3 distribution. It has been updated now to use RUG 4 distribution, or also known to us as RUG 48. The next slide is about our changes with the quality measures. The quality measure changes are not being reported due to the COVID-19 public health emergency. The MDS-based or claim-based quality measures will not report any data after December 31st, 2019. I do have a side note that CMS will communicate any changes to stakeholders in advance or prior to updating the Nursing Home Compare website. So if they decide to use the quality measures or the claim-based data at another time for 2020, they will release updates to notify nursing home providers. And this is just a review of what I just said. The next area is the health inspection ratings. The changes with the health inspection, I know you guys, for a minute, they were not doing surveys. They were just doing infection control focused surveys to ensure that residents in the nursing homes were being protected. Well, they were not using those health inspections for your health inspection rating. And they have decided to not use any health inspection that was conducted after March 4th of 2020. The health inspections are still posted and publicly reported. They are just not used to calculate your actual health inspection rating. If you guys have any questions, you remember to please ask them in the comment sections below. And again, thank you for watching this video that was presented by AIM Sustainable.